Minister, 1 in 2 people will develop cancer during their lifetime. Getting a cancer diagnosis is overwhelming and it is terrifying. Many, or most, if not all of us, have lost loved ones to cancer, but we also know many people who have survived. Screenings, improved treatment and excellent care are all increasing survival rates. However, this comes at a deep physical, emotional and disgracefully a financial cost. This financial cost is callous and it is uncaring. Not only are cancer patients charged for their care, hospitals use debt collectors to pursue individuals and families dealing with the turmoil and toll of cancer. Patients without a medical card or private health insurance are charged for inpatient treatment, including life-saving chemotherapy and radiotherapy at a cost of €80 per visit. Then there are the numerous other costs, from medication and counselling to childcare, wigs and heating and outrageous parking fees in hospitals. The Irish Cancer Society estimates that the average cost to someone diagnosed with cancer is €756 a month, but can be over 1,000 in some cases, while at the same time, people are faced with a loss in income of over €1,500 a month on average. The Minister and the HSE know all of this. The inadequacy of the response to the lived reality of cancer patients and survivors is truly staggering. This awful and terrifying disease is made even worse by government health policy. This has to stop, and it can stop today. In the words of a constituent who contacted me on Monday, the cost of cancer is disgraceful, and it's when you're at your most vulnerable. The government should support our motion to provide relief and support for the thousands of people who are currently undergoing treatment and the thousands more who will be into the future. Abolish the €80 inpatient charge. Direct the HSE to end the practice of using debt collectors. Honour the programme for government commitment to cap daily charges for car parking at public hospitals and introduce flexible passes for patients and their families. The constituent describing the impact of the cost of cancer care outlined how his medical bills skyrocketed as he had to pay for medicines, pain relief, GP bills and much more. He eventually got a medical card after months of wrangling and, as he described it, fighting with the HSE. The state doesn't need to make cancer even more difficult for people and their families. Cancer support services are also desperately underfunded. I very recently visited Cork Arc House in Bantry, which provides a range of support and care for people diagnosed with cancer and for their families, from vital information and advice to counselling, wigs, art therapy for children to practical supports. In 2001, they had over 1,500 active users, up from 1,200 in 2020, and they provided over 10,000 services. Disgracefully, truly disgracefully, Cork Arc Cancer Support House receives only $45,000 annually in HSE funding towards the centres in Cork City and in West Cork. That represents just 5% of their overall income, the rest of which is fundraised. This is an incredible service which makes an immeasurable difference in the lives of cancer patients and their families during and after treatment, yet they receive only 5% of income from the HSE. They're rightly seeking an increase in funding to ensure that their services can expand and continue to meet the ever-increasing demand. Cancer can have a long-term cost and life-altering impacts which patients too often have to pay for. This week I was contacted by a young woman who had to have a hand amputated due to cancer. She quickly realised that public-funded healthcare and support falls so far short of what is required. Minister, she doesn't qualify for a primary medical certificate to allow her to purchase and adapt a car because she had one hand amputated rather than the criteria of 2 hands. She's forced into getting and adapting a car herself to allow her to return to work and to care for her child. In addition, the public cover of prosthetics in Ireland is the worst in Europe. She will need 3 prostheses in her first year and the public system only covers 1. The cost is shocking for this woman who wants to recover, get back to work and live a full life. However, the cost of cancer care is a government choice. There isn't a person in Ireland who isn't affected by cancer. There isn't a person in Ireland who would oppose reducing the cost of care. So why would the government? Minister, I would sincerely hope that the government will go further than not proposing a counter motion today.
Thank you.